Hello, good day everyone. I'm going to discuss how to assess skin, hair, and nails. Perform hand hygiene and put on PPE if indicated. Provide for client privacy. Explain the purpose of integumentary examination and what you are going to do. Hello ma'am, I am Lance and I will check or assess your skin, hair, and nails, and we will look for any abnormalities and lesions if they are present. Is that okay?
Yes.
Ask the patient to remove all the clothing and put on an examination gown if appropriate. The patient remains in the sitting position for most of the examination but will need to stand or lie on the side when the posterior part of the body is examined, exposing only the body part being examined. Use the bath blanket or drape to cover any exposed area other the one being assessed. Inspect the skin coloration. In assessing the skin color, make sure that the skin color is even, and also make sure that there are no lesions and any swelling part of the skin, and also make sure that there are no jaundice because you might have a problem in liver and gallbladder. Inspect skin for vascularity, bleeding, and bruising, and also inspect the skin for lesions. As you can see, there are no lesions, bruises, scratches, cuts, and insect bites, and wounds. So that's the good indication that the skin is in good condition. If present, note the size, shape, color, exudates, and distribution. Palpate the skin using the back of your hand to assess the temperature. Make sure the temperature is not too low, not too high, and make sure that the temperature is within the normal range. Palpate the skin for texture and moisture. As you can see, the skin is smooth and firm. Skin that is rough may indicate a problem with keratinization. This is when the epithelial cells lose their moisture and become dry. Assess for skin turgor by gently pinching the skin under the clavicle. By doing this, we will see or know how the skin comes back fast in place. Also, the purpose of this is to determine the extent of dehydration or fluid loss in the body. Palpate for edema, which is characterized by swelling with taut and shiny skin over the edematous area. By doing this, we will look or observe for edema around the foot, ankles, and legs. As you can see, there are some insect bites but there are no edema, any swollen areas around the foot, and there are no indentation being seen. If the lesions are present, put on gloves and palpate the lesions. Inspect the nail condition, including the shape and color as well as the nail angle, noting if any clubbing is present. Normal nails are translucent, shiny, and firm in texture. As you can see, her nails is shiny and firm in texture, and the shape is round. Also, look for any clubbing of the nails. Clubbing of the nails is a deformity of the finger associated with number of diseases, mostly of the heart and the lungs. So you need to make sure that your nails is always clear, smooth, and no deformity and clean. Palpate nails for texture and capillary refill. To do that, we're going to press the nail bed, and if there is good blood flow to the nail bed, a pink color should return in less than 2 seconds after pressure is removed. It is used to monitor the hydration and the amount of blood flow to tissue. A prolonged capillary refill time may be a sign of shock and can also indicate dehydration and decreased peripheral perfusion. Peripheral perfusion is an appropriate response to low circulating blood volume and reduced oxygen delivery to vital tissues. Inspect the hair and the scalp. Wear gloves for palpation if lesions or infestation is suspected, or if hygiene is poor. While you're inspecting the hair, look for any lesions, lumps, any dandruffs, because your skin can be irritated. Also, make sure that there are no infestations like lice. As you can see, Her hair is clean, no lesions, no lumps, no dandruffs, and infestations. So that's the good indication. Lastly, remove gloves and any additional PPE if used. Perform hand hygiene. Continue with assessment of specific body systems if appropriate or indicated. Initiate appropriate referral to other healthcare practitioners for further evaluation as indicated. And you need to document findings in the client record.